Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.
There is that fear of the unknown.
The coronavirus not here yet, but experts say it's coming.
I do want to say that there's absolutely no need to panic.
The governor says the state is ready to address coronavirus.
It's certainly achievable, but it takes hard work, it takes commitment.
Dialogue about the Reset Louisiana plan.
Hi, everyone. I'm Natasha Williams.
And I'm Andre Morrow. Much more on those top stories in a moment on this week's edition of SWI. But first, a look at other news making headlines across Louisiana. Up to 31,000 people in Louisiana who get food stamps could lose benefits under a new rule from the Trump administration. The ruling begins April 1st and enacts tougher work requirements on adults who have no children. The Department of Child and Family Services will contact those affected with information about how they can keep on getting assistance. A company that produces visual effects for major movies and TV shows has expanded into Baton Rouge. Crafty Apes has developed visual effects for pictures like Jumanji, The Next Level, Little Women, and Star Trek Picard. Governor John Bel Edwards says the state's entertainment job creation program is gaining traction, with a number of permanent jobs already coming into New Orleans, Shreveport, and now the capital city. The Foundation for LSU has named Robert Stewart Jr. as president and CEO. Stewart has a long background of volunteering with the university in fundraising and other efforts. He was serving as interim foundation president. During his tenure as chairman of the foundation's board, Stewart led preparations for the $1.5 billion endowment campaign called Fierce for the Future. The campaign recently reached its halfway mark a year earlier than expected. The leader of the state's biggest agriculture network is retiring. Ronnie Anderson is stepping down from Farm Bureau this summer after 31 years. He is the longest-serving Farm Bureau state president in the country. Under Anderson, the agency has grown into a powerful political force. When he took over in 1989, the group had 67,000 members. It now has more than 148,000. More than 20 people have applied for the job of state education superintendent. The group includes higher ed professionals from Louisiana, Texas, and Tennessee, plus public school teachers, consultants, administrators, and educators from across the country. Superintendent John White announced in January he would resign this month after 8 years on the job. Senator Bill Cassidy launched his bid for re-election this week with an as-expected official endorsement from President Trump. It came in the form of a tweet. Said Trump, "You have my complete and total endorsement." Cassidy is a medical doctor and regular Trump ally in Washington and is running for a second 6-year term. The Festival International de Louisiane officially announced its 2020 schedule. It is the annual music and arts fest held in Lafayette, celebrating the French heritage of the region and its connection to the Francophone world. This year's event takes place April 22nd through the 26th. Program Director Lisa Stafford calls the festival one of discovery and says it's like a trip around the world, but instead of 80 days, we bring it to you in 5.
A new $600,000 grant will provide cancer screenings in Northeast Louisiana in 12 parishes that have some of the highest rates of cancer, often not detected until late stages.
The Blue Cross Blue Shield Foundation announced the 3-year investment in Monroe this week. It's in connection with the Mary Bird Perkins Cancer Center.
The number of coronavirus cases continues to climb in the U.S. The disease has killed more than a dozen people in several states. The good news is no one in the Bayou State has become infected, but experts say it's only a matter of time. The Our Lady of the Lake Hospital Association has formed its own task force trying to stay ahead of the issue. We talk with a local infectious disease doctor at the lake to separate fact from fiction. Cheryl Laperouse has been a nurse for more than 30 years, and she says she's concerned that the deadly disease will continue to spread.
I worry about the healthcare providers that are in the middle of this action, and I pray that, they're safe. If you don't have those folks to help you out, it can be a problem.
Those serious concerns are shared by others in the medical field.
If you didn't have a plan for how to go through a respiratory virus season with good health, now it's time to learn. So we cover our cough, we avoid sick people. We encourage people who we work with to stay at home if they're ill so that we don't spread within our office spaces and at our schools. You call your doctor if you're not feeling well and get recommendations on what you should do.
Dr. Catherine O'Neill is an infectious disease doctor at Our Lady of the Lake Hospital. She says we should all follow some of the same practices we always do to avoid getting sick.
When you have a sick person at home, you wipe frequently used high-touch surfaces often because that does decrease the likelihood that you'll get sick from them. The most important thing, the number one thing that you should always do every day, all the time, is wash your hands. Absolutely. Washing your hands is the number one preventative.
And she says those with health issues should take even more precautions.
Even more important, washing your hands should be a routine and not touching your face. We've talked a lot about that in previous conversations about avoiding the flu, and CDC's continued to reinforce that this virus that we're so concerned about is spread through being close to somebody who has the virus, but also by touching surfaces. If I touch surfaces with germs, how am I going to get sick from touching them? Because I'm going to bring them to my face. And so that portal of entry is your eyes, your nose, your mouth. So don't touch your face when you're around crowded areas. And I think that that's very, very important and honestly should just become something that we all do all the time.
But now many are worried despite all that they do to avoid it, it might not be enough.
I think that what we're seeing is what CDC warned that we would probably see, which is community spread. So now spread not related to our original risk factors, but spread within communities. So when that happens, what is the next phase of the pandemic plan? And that is testing community members who might come in with influenza-like illness. We saw a change in our screening recommendations from CDC yesterday to reflect that. If you see somebody with signs and symptoms of coronavirus and you've ruled out all of the other things we look for in patients this time of year, then you can request testing. And that was something that we didn't have before, but now that we've seen a community event, we're going to be on the lookout for.
Experts say it's not a matter of if, it's when we will all see many more people getting sick as it spreads through communities. Some are wondering out loud about the availability of test kits. Will there be a shortage?
I've never had a problem getting a sample to CDC when I wanted it, whether it was for Ebola, whether it's for diarrheal illness in the community. When we need the CDC, they've always been there and we've gotten timely results. So I don't anticipate a problem. I know people are worried, but so far it's worked out just fine.
Are we at a point when you should avoid big events? Should you avoid very heavily populated games, concerts, things like that?
Right. In Louisiana, we are not there yet. In Louisiana, because we have not exhibited any community spread, because we have not had a single patient in Louisiana diagnosed with the disease, I would begin to think about your plan if coronavirus is here, but for now, go about doing the same things that you've been doing because we haven't had a case here.
How about flying? Is it still safe to fly?
We have had no warnings about general air flight. We've had warnings about flying to certain areas. So I think every day if you're planning on flying, you should go to CDC's travel alerts page and make sure that your destination has not been added.
But what about cruising? Hundreds were infected and at least a half dozen died back in February after being quarantined on the cruise ship Diamond Princess in Yokohama, Japan.
CDC has given a recommendation that they do not recommend that anybody go on a cruise in the Asian Pacific area, and I think that we should all heed that warning. If you have a nice cruise to Cozumel scheduled in the next week or two, right now we don't suspect that those cruise lines have been affected by this virus, and I wouldn't change your plans until you hear otherwise.
How do you calm the fears of people? Because I get a little anxious myself, and I try to stay as educated as I can be about it, but it gives me a little pause, to think when I see the numbers keep going up, I keep waiting for it to say, okay, it's going to be here, it's here.
Right. I've never been a huge social media user, and I would limit the amount of social media that you're looking at unless it's linking to something that is official. So when I read the warnings from the CDC, they make me pause. They don't fill me with fear. They make me want to have a plan of readiness. When I read my social media pages, they make me fearful. So my recommendation is stick to the sources that you know.
People are wearing masks. People are stockpiling groceries, canned goods. Too early?
Masks, absolutely. We do not need to be wearing masks to protect ourselves from the general public. If masks worked, we would have stockpiled masks years ago for H1N1. Every time the influenza hit, we'd all put on our masks. It doesn't work, and it doesn't work because we touch our face throughout the day. So there's really no protection from the mask because you keep using the mask within your daily work. The other way masks work is if I'm sick and I'm entering my doctor's office with a fever and a respiratory virus and I don't know what I have, by donning that mask, I protect everybody in the room in case I have a forceful cough. So if you're sick, you wear a mask. If you're going to see someone sick, you wear a mask, and otherwise don't put a mask on your face. It's false security.
And as for those extra groceries,
do the same things you would do in anticipation of an event that might disrupt our community. I wouldn't stockpile. I wouldn't have a year of groceries, but my mom kept Vienna sausages. I keep peanut butter. Whatever you need in your cabinet to have a few days where you don't want to go to the grocery store and the stores may be closed and your schools may be closed. Do you have enough to sustain yourself?
And believe it or not, it's not too late to get your flu shot.
Imagine the anxiety you'll have as an unvaccinated individual in this city in a month when you develop fever and respiratory symptoms, right? And you have the flu because it's the middle of flu season and we still have a lot of flu. And then you go to a waiting room full of people who have fever and respiratory symptoms and have to sit there and wait with them. I would rather get my flu shot and not have to experience that.
And Mark Lucas says he's doing all he can to avoid getting sick, but he can't help but worry, and he's not alone.
There's so much they don't know. And the parts that they do know, they only let the public know what they want us to know.
I'm mildly concerned, not overly concerned. I've been a public school teacher for 38 years, so I've been exposed to everything that's come around for that long. And I just think people are in panic mode, and if you are careful, it's not any more of a concern of having the regular flu that goes around.
And for longtime nurse Cheryl Laperouse, caution is king, but without panic.
There is that fear of the unknown, but, we still have to wait and see. Let's keep an eye on it.
Again, there are no confirmed cases of the coronavirus in Louisiana right now. Health experts say symptoms will be mild for 90% of those who do become infected.
At the beginning of the week, Governor John Bel Edwards announced he has formed an emergency task force to lead the state's planning for the coronavirus.
He said while there are no confirmed cases, the spread of the virus to the state is inevitable. He spoke Monday to the Baton Rouge Press Club.
Louisiana has been working on pandemic preparedness for the last 15 years. We have a comprehensive state pandemic plan. We have also encouraged pandemic planning throughout the state, both in the governmental sector as well as the private sector. When we have a presumptive positive test in Louisiana, we will disclose that at the state, and we will do it very quickly. I think this is important because the public's heard a lot of concerning information over the past few days and are probably going to continue to hear more of this over the coming weeks or months, even about the coronavirus. I hope that people will look for information from good sources like the CDC and avoid the gossip or speculation that we're already starting to see. When it comes to cases of coronavirus in Louisiana, if you've not heard it confirmed by the Department of Health, it is not real, period. Our aim is to provide information that the public needs to prevent the spread of the illness while protecting the privacy of anyone who may find themselves infected, with this particular virus. Already in Louisiana, our health department has been communicated on a regular basis with health providers and doctors to proactively share information about symptoms and also guidance about when someone needs to be tested. I do encourage anyone in the public who wants more information particularly at the state level, to go to ldh.louisiana.gov/coronavirus. ldh.louisiana.gov/coronavirus. We have the capability to test for coronavirus in-state, and the Office of Public Health will be handling those tests for providers across the state. Late last week, the testing protocol was expanded, and the new testing criteria are fairly broad, and most of the people who are going to be administered these tests we fully expect to be negative. That was the case in the one individual who was tested over the weekend, not the novel coronavirus. But if you present to a healthcare provider and you have symptoms that are consistent with coronavirus and no alternative diagnosis happens, then you will be tested. If you've recently traveled to China, South Korea, Iran, Italy, or Japan within the last 14 days, and certainly if you experience any fever, cough, or other kind of illness, contact your healthcare provider as soon as possible and tell them about the symptoms and about the travel. There's absolutely no need to panic. In fact, not only is there no need to panic, that's exactly the wrong thing to do, but we should all take this seriously, prepare for this, and arm yourself with the facts.
And more information about the virus this week at the Rotary Club of Baton Rouge.
Dr. Susan Bankston, a pediatrician at Baton Rouge General, was guest speaker, and she focused on the importance of vaccines. She also talked about the illness that everyone is talking about, the coronavirus. Dr. Bankston gave us even more information, dispelling a number of myths now associated with the virus.
Everybody wants to be tested. Everybody calls and says, I want to be tested. And the bottom line is you have to meet so much criteria, so many things. Have you been to one of these countries? Do you have fever? Do you not have the regular flu? Do you not have this? Do you not have that? Before the team will even allow you to be tested. So you can't just go to your doctor and say, test me, I think I have it. You will have to have the answers to a whole bunch of questions, like where have you been? Have you been to Iran, Italy, all those things, and then maybe, in certain parts of it, maybe you'll be tested. It's a cold virus that attacks the lungs. And so in China, in Iran, where there's lots of smoking and lots of smog, they are dying because they had bad lungs to begin with. The people in Washington who died were people who were sick, they were infirm in a nursing home. I'm very sad about that. I'm not making light of that, but what I'm saying to you is the average healthy person is not going to have a problem with this. But to help yourself, wash your hands. They say you should stay 6 feet away from somebody. You probably won't get it, but as you get closer, they could spit at you, kind of deal. But it's not so much that you have to worry about you catching it to where you wear a mask, which there is no recommendation to wear a mask right now. But if you know you have coronavirus, you ought to wear a mask so that you're not giving it the other way. It's why we'll have you, if you think you have flu, to put on a mask at our office so that you don't spit on somebody, not that so you don't get it. It's much like the flu, upper respiratory, cough, shortness of breath, fever. Those all, you get a little short of breath when you get congested, that sort of thing. Only 1 in 6 who get it get the life-threatening illness. And the reason why you cannot compare the flu numbers as easily to the coronavirus is because the flu is a very easy test. I tested about 10 before I came this morning, and the bottom line, there were like 4 positives. And the bottom line is there's no test for corona. So you come in with a fever, little cold, you might have the coronavirus, but I don't know that you have COVID-19. I just know that you probably have a virus, and you will get over it because it's a cold. So we may have a lot of people with this one as they filter in because it is human-to-human spread. It used to only be bats to humans. It is now human-to-human spread. We know that.
Wednesday, the Supreme Court started to hear arguments that could fundamentally change abortion rights. At the center of the debate, a women's clinic in Shreveport, one of only 3 in the state that perform abortions.
Yeah, at issue is upholding a Louisiana law that would require doctors at abortion clinics to have admitting privileges at a nearby hospital. Senator Bill Cassidy had this to say at a media briefing from Washington earlier this week.
I've always been pro-life. I will have the privilege of sitting in the Supreme Court when they hear the Louisiana hospital admitting privileges law that the physician who performs an abortion must have admitting privileges. And it goes back to my training as a physician. If you do a procedure, you have to be able to manage the complications. And you can't manage complications if you don't have admitting privileges. If the person doing the abortion pokes a hole in the uterus, what's he going to do to take care of the mother? So this bill is about the health of the mother. I look forward to hearing the oral arguments, but as a physician, I am strongly for that.
If this bill is upheld, there would only be one abortion clinic in Louisiana meeting the legal requirements to operate. The state is familiar with this high court decision because in 2016, the court struck down a similar law in Texas. Kathleen Pittman is the director of the Hope Medical Group for Women in Shreveport, and she told the New York Times Tuesday the goal of the state lawmakers is to drive all abortion clinics out of business in the state. She said Roe means nothing if you can't access abortions. A decision on the law isn't expected until sometime this summer.
Former Governor Kathleen Blanco believed education was a fundamental solution to poverty. So how proud she would have been at the first ever event this week at the Blanco Public Policy Center on the campus of UL-Lafayette. A detailed discussion of the Reset initiative to recreate Louisiana's future.
Governor Blanco was very much an advocate for the benefit of the entire state.
Stephen Barnes, founding director of the Blanco Public Policy Center, saw hallmarks of the Blanco legacy on display as leaders discussed the Reset Louisiana initiative.
So we've been working with the Committee of 100, the Council for Better Louisiana, and the Public Affairs Research Council to put together a program to dive a little deeper into some of the policy areas that they've been working on over the last year or so.
The Reset agenda includes long-term policy recommendations in the areas of education, state finances, infrastructure, and criminal justice. Barry Irwin, president of CABLE, or Council for a Better Louisiana.
When you look at the various rankings that we have that rank us as states in all the different states around the country, these are parts of all of those rankings. And we feel like these are ones where we can make a difference, where if we actually enact some change, we can move the needle and move the state forward, and things that we believe that people really want to see happen overall.
We're looking to establish the kinds of action that we can take that are going to lay the foundation for the benefit of the entire state. So we want to implement policies that will affect workforce, that help businesses throughout the state, that give workers opportunities in every community. And similarly with transportation, infrastructure, we want to make sure that we're making the right investments to help the state as a whole grow.
Commissioner of Higher Education Kim Hunter-Reed was a longtime Blanco aide.
She was a person who felt that data-driven decision-making was important, that good policy and people were more important than politics. She wanted to make sure that she was lifting education as a former school teacher herself. She knew the value of that. Her husband, obviously, coached at UL-Lafayette, and so they had this rich legacy of understanding the value of education, what it meant to families, to students. And so I'm sure she's mighty proud about this conversation today.
Reed says sending all children to kindergarten ready to learn and building the talent pool in the state are musts for the state to improve ratings and outcomes.
Well, obviously we need a full court press, right? We need to invest in early childhood. We need to make sure that the teaching profession is lifted, that teachers are paid well, that students understand that the high school diploma is the floor, not the ceiling, that they need to go farther, that adults have an opportunity to retool or to upskill in this knowledge economy. And so I think prioritizing education, ensuring that we see it as an investment, not an expenditure, and having a long view, a long commitment to it is very important.
Public Affairs Research Council President Robert Travis Scott noted a slogan of Reset, that nothing changes when we wait. He believes timing can help make the Reset plan work.
Reset Louisiana has put together a really actionable, practical, but still visionary plan for where this state can go. And this is something we want legislators and the public to embrace, to get themselves educated about. This is the first session of a new legislative term. We've got a bunch of new legislators in here, and I think they're going to have a lot of energy. They're going to have a lot of desire to want to make some change in this state. And so you've got to believe, you've got to have a plan. That's what we're doing. Reset was created in 2019, and we've been around the state, promoting the agenda that we have with Reset Louisiana. And now is the time, with this new legislature coming in, that we had targeted, to begin for these things to really take traction and for change really to begin. We're thinking this session and next year's session will really be when Reset can take hold.
Irwin says the state's tax structure should be easier, more competitive, and transparent.
Now our tax burden is lower than 8% because we have credits and deductions and exemptions that allow businesses to ratchet down to that. But every one of those is a step they have to go through. And the message that we send with a high rate is that, hey, we're not a very favorable place to come, while secretly and more quietly, we really are a good place to come.
We have not been nearly as successful as places like Austin, Texas, in getting the technology industry. That's a fantastic industry if we can get that. But to do that, we have to bring in people from out of state, which is how you grow. Also educate our people more so they can also participate in it. But again, it's not a one-year turnaround. It is a 4, 5, 10-year turnaround.
The upgrade of infrastructure, another part of the initiative, really can't happen overnight, but will never happen without action.
We have to say no more. We're going to invest. We're going to advance policy that makes a difference. We're going to ensure that our state is better than ever before. And so I think we have to have urgency about this work, and we have to be tired of being last and committed to being first and working diligently and collaboratively to get there.
And the 2020 session of the legislature begins Monday, the 9th of March. Our live coverage begins at 1 p.m. with the governor's address to the legislature, the official start of session 2020 on air and streaming live online at lpb.org.
And as a reminder, LPB is currently taking nominations for the 25th anniversary of Louisiana Young Heroes.
Yeah, Young Heroes honors high school students grades 9 through 12 who serve their communities, have overcome adversity, or have inspired others through their actions and strength of character.
Nominations close on Monday, March 16th. If you'd like to nominate a Louisiana Young Hero, go to lpb.org/heroes.
And everyone, that's our show for this week. Remember, you can watch anything LPB anytime, wherever you are, with our brand new app.
Download it for free from your app store. This upgraded version features news, public affairs, documentaries, how-tos, and many more programs. And please follow us on Facebook, Twitter, and Instagram.
For all of us here at Louisiana Public Broadcasting, I'm Andre Morrow.
And I'm Natasha Williams. Thanks for watching.
Until next time, that's the state we're in.
Entergy is proud to support programming on LPB and greener practices that preserve Louisiana.
The goal of our environmental and sustainability initiatives really is to ensure that our kids and future generations can be left with a cleaner planet.
Additional support provided by the Fred B. and Ruth B. Ziegler Foundation and the Ziegler Art Museum located in Jennings City Hall. The museum focuses on emerging Louisiana artists and is an historical and cultural center for Southwest Louisiana. And the Foundation for Excellence in Louisiana Public Broadcasting, with support from viewers like you.